You know that feeling when a major health crisis hits? It can feel like absolute chaos. But what if I told you that behind the scenes, there's actually a global rulebook? A plan designed to keep all of us safe. Today, we're going to pull back the curtain on that very rulebook.
I mean, it's the first question on everyone's mind when things get really serious, right? Who's calling the shots? Without a clear plan, you just get confusion. Well, there's an international agreement designed to answer that exact question.
Okay, so let's dive right in. The answer is something called the International Health Regulations, or IHR for short. And you can think of this as the world's blueprint for keeping us all healthy and secure.
So what is it exactly?
Well, the IHR is a legally binding agreement, a promise between 196 countries. That's pretty much every nation on Earth. And they've all agreed to work together to spot public health threats and stop them before they can spiral out of control and cross borders.
And this, right here, shows you the incredible balancing act they're trying to pull off. See, the goal isn't just to stop diseases, period. It's to do it in a way that doesn't bring the entire world to a grinding halt. It's all about protecting our health while still allowing travel and trade to continue as safely as possible.
So how does this all work in practice? This is the really cool part. The IHR basically functions like a global fire alarm for diseases. But instead of detecting smoke, it's designed to pick up on the very first signs of a dangerous outbreak. The whole process really boils down to 4 key steps. First, every country has to be able to detect anything unusual happening within its own borders. Then, if they find something that could be an international threat, they have to notify the World Health Organization, the WHO, and they have to do it within 24 hours. It's a legal requirement. Third, the WHO steps in to help verify the threat. Is this the real deal? And finally, if it is, the WHO helps coordinate a global response. It's this constant cycle of detection, communication, and collaboration. This quote really gets to the heart of the whole thing. It's all built on this idea of universal protection. The thinking is pretty simple. A health threat anywhere is a health threat everywhere. So the response has to be for everyone, by everyone. No one gets left behind. Okay, so if we've had this system in place, why is there all this recent buzz about changing it? Well, like any good playbook, you have to update it after you've actually played the game. You learn things. The modern version of the IHR was actually set up way back in 2005, but after facing some pretty major global health events, it became clear that some upgrades were needed. So in 2022, they tweaked some procedures. And then, just this year in 2024, they adopted a huge package of major updates, which are all set to kick in around September 2025. So what exactly is new? How do these changes actually make for a stronger, better framework for all of us? Let's get into the specifics of the 2024 updates.
All right, this is probably one of the biggest changes. They've created a brand new top-tier alert level called the pandemic emergency. Think of it as a level above the alert we used to have, the PHEIC. This new pandemic emergency is the big red button you push when a disease isn't just a threat anymore, it's actively spreading across the globe, it's starting to overwhelm hospitals, and it's causing massive disruption. The whole idea is to trigger a much faster, much more powerful international response.
But it's not just a new alarm bell. If you look at the 2024 updates, they're really built around 2 powerful ideas, solidarity and equity. There's now a huge focus on making sure every country has fair access to things like vaccines, tests, and treatments. And to make that happen, they're setting up a new coordinating financial mechanism. This is so important because it's designed to help developing countries get the money they need to build up their own public health systems. We've all learned the hard way that a global chain is only as strong as its weakest link.
So that brings us to the most important question of all. With all these new rules and updates, are we actually safer? Are we better prepared for whatever comes next?
Look, there's no question the updated IHR gives the world a much more powerful toolkit. The alarm system is clearer, there are new ways to get money where it's needed most, and there's a real commitment to fairness. But here's the thing about a toolkit. It's only as good as the people using it. The success of this whole thing comes down to the commitment and the real, genuine collaboration of all 196 countries that signed on the dotted line.
So we'll leave you with this final thought. The Global Health Rulebook has been rewritten. It's been updated with some incredibly hard-earned lessons. On paper, the plan is stronger than it has ever been. The real challenge for the entire world now, turning those words on a page into unified, decisive action on the ground.